Well, hello and welcome to the first of the Scottish Drugs Forum's winter webinar series. I'm Austin Smith and I lead in policy and practice at SDF, and I'll be your host for the next hour. This webinar will focus on the human rights of people affected by substance use and the newly published Charter of Rights, which was officially launched by the First Minister last week at an event in Glasgow. So it's real and it's here. And today we're going to look at some of the implications of the Charter and how it was produced. There's a link in the chat so you can download your own copy, and there's various formats available. So it should be accessible to everyone. As many people will know, there's been talk about a rights-based approach in the drugs field for some time, not least in terms of national strategy, but much of this has been vague and aspirational, and rights have been poorly defined, if defined at all. So this promises to change with the publication of the Charter. Over the next hour, we'll hear about the promise and the possibilities opened up by taking a rights-based approach to developing policy and services. We have contributions from three key people involved in this cutting-edge work. Professor Alan Miller led the work of the National Collaborative, which was established in 2022, which developed the Charter itself. My SDF colleague, Jason Wallace, was crucial in ensuring the involvement and participation of people with living experience in the national collaborative process. And today, he'll focus on the responsibilities we have under the Charter to change policy and service delivery. And Louise Stewart, who was not only involved in the work of the collaborative, but as Director of Service Delivery with you, will manage the delivery of rights-based services and ensure that people's rights are respected. Afterwards, we will hopefully have time to respond to questions from people attending today. So if you have any questions, please put them in the question and answer section at the bottom of your Zoom window and not the chat function. Please, if you can avoid the chat function, use it as you want, but not for questions. And please do this during the presentations rather than at the very end, because a rush at the end is hard to manage and we just won't get a chance to answer questions. So, without further delay, I'll introduce you to Professor Alan Miller, who headed up the National Collaborative. Alan.
Well, thanks very much, Austin, and thanks through you to SDF for inviting me on this webinar, and also for all of the support that SDF gave to the process to launch the Charter last week. And can I also make sure that I thank in advance my co-presenters, Jason and Louise, who were right at the heart of all of the work to develop the Charter of Rights. So, Austin, you were there on the morning of the launch last week, but many of those who will be looking at this webinar weren't. So I thought I would just share some of the slides that were shown at the launch. And the first one up in front of you there, I'm not going to go through in any detail, but it just gives you a bit of an insight into what the journey has been to the launch of the Charter, going back from the time I was appointed by the then First Minister, Nicola Sturgeon, to build and to help lead the National Collaborative. And there then, as you can see, was a really in-depth listening to those with life experience of substance use telling us what wasn't working and how things needed to be made to work better. And it was based on that experience that we heard from all around the country that we then, through a lot of consultation, produced and launched the Charter of Rights for people affected by substance use just last week, December the 11th in Glasgow. So, as you can see, it was quite a long and winding road, but we had to make sure that we really understood and got under the skin of the problems so that we could point towards what needed to be done to find solutions. And it was also quite deliberately, a long and winding road because we wanted to bring everybody with us, everyone who had experience and had an insight into what needed to be done, both those people affected by substance use themselves, their families, their recovery communities, and also those who had responsibilities to design, deliver, and monitor the support services that are provided. So that was the journey, but let's move on to where we were last Wednesday when we launched the Charter of Rights. This was the product of all of that work. And then just to go to the next slide to give you a sense of what are the 7 key rights that you will find in the Charter if you go on that link in the chat box. I'm not going to go into any detail on any of these, but these are all rights that come from national and international human rights law, either rights that are already in our law or rights that belong to us because they are recognized in international human rights law. And many of them are captured in the international guidelines on human rights and drugs policy, which is backed by the UN. So that's the Charter. Those are the key rights. You can find out all about them. There are different versions of the Charter. There is the full Charter, which you have the link to. There's also a summary in more accessible language of the Charter. There is an easy read version and there is an animated version. So we really want to get the Charter out in different formats so that it can be understood and used. And I'll then therefore move on to the next slide. The next steps are very much to put the Charter into practice. And the approach that we want people to take with putting the Charter into practice is to use it to strengthen the work that you're already doing. So to improve what it is you're doing, if you are either in advocacy, or involved in designing, delivering, monitoring support services, use the Charter to strengthen what you're already doing in taking a human rights-based approach. And then commit to actions, using the Charter and its toolkit to make it work for you in practice, because you know best on the ground what value it will have, and then to share the lessons that you learn from putting it into practice that others can benefit from. So there'll be a meeting early next year convened by the National Collaborative and the Scottish Government, and it will be to develop this approach and actions to be included in a plan to embed the Charter in advocacy, design, delivery, and monitoring of public services. So the next slide that's coming up. The steps beyond the event next year, which will be to sort of co-produce in a collaborative way a plan to use the Charter. Beyond that, we want all of the Charter rights, all of these 7 rights, to be put not only into policy and practice, but also into law through the proposed Scottish Human Rights Bill, and in particular, the right to the highest attainable standard of physical and mental health. The government is committed to introducing the Scottish Human Rights Bill, and that will really underpin the Charter of Rights. So it's not a matter of choice whether a policy is developed or whether it's put into practice, but it'll be a matter of law and a matter of duty for service providers. And that's important. The sort of strapline of the National Collaborative, which we agreed on way back, was we need change. And to get change, we need rights and accountability. And that will bring about the shift in power and the shift in culture that is needed to improve and to save lives. So if we could then go on to the next slide, and that is, we didn't want to just develop a Charter and put it out there and then kind of leave it to its own devices, but we've developed a toolkit to help everybody actually understand how to put the Charter into practice in everyday life. And to help us do this, we also arranged a number of very important roundtables, what we call human rights interactions, when we brought together the change team of the National Collaborative, that is people with different forms of life experience of substance use that had worked to develop the Charter. We brought together to have an interaction with them a panel of duty bearers, that is people involved at different levels of decision making in design, delivery and monitoring of support services. And we asked them to sort of interrogate what we'd done, to challenge us, and to make sure that we understood what they needed to put the charter into practice, how it would be made easy for them to actually do what they needed to do. Because we don't want a situation where, in a month's or a year's or 2 years' time, someone pitches up looking for the support they need, and the person that they then meet in the NHS or the pharmacy or the GP doesn't know what they're talking about, doesn't know what this Charter of Rights is or what it means for them. So what came out of these interactions was a toolkit, which will have a number of things in it. And again, if you go on that link to the Charter, it will take you through to the toolkit. But just to summarize some of the things that are in that, there will be a right to health checklist. That is a checklist that can be used by advocacy bodies or individuals to understand their right to health and what that means and what they can expect to get. And also for duty bearers, what they are expected to be providing to those people who need the support. And the right to health checklist is based on international best practice, which is called the AAAQ. What that means is that there has to be available in sufficient numbers a choice of what sort of support an individual needs, what sort of recovery it is that they want, what that means to them, and certainly including harm reduction. That the services provided have to be accessible, that is, they're within reach, and they're financially affordable. There's no barriers. And they have to be acceptable. That is, wrap around and fit the person and not expect the person to jump around from one place to another or have one door open and another door shut. For example, mental health problems and addiction treatment that, they're not given together at the same time. And they have to be of sufficient quality, trauma-informed, people participating in what kind of support is made available to them, and that whatever support is given, whatever service, should be subject to oversight and scrutiny from the inspection bodies. And then there's a fair model of how to apply a human rights-based approach in practice. And the next slide gives an example of the benefit that can bring. Because one of the things that we were told when we went around the country was that the relationship between alcohol and drugs partnerships, ADPs, and lived and living experience groups really needed to be made better, so that LLEs were able to participate in a much more meaningful, impactful way than is happening at present. And many ADPs also told us that they were frustrated, that sometimes they felt it was no more than a token or a box-ticking exercise to listen to LLE groups that without really changing what they did as a result. So the FAIR model stands for Facts, Analysis, Identification, Review, an acronym for FAIR. It's a very flexible, adaptable, sort of common sense way of improving that relationship and making it much more meaningful, that the local support services provided meet the needs, the experience, and the rights of local communities and individuals who need the support. So you start with a shared understanding of what are the concerns from people affected by substance use. What are the barriers they experience? What isn't working, and how can it be made to work? And that shapes the agenda. That shapes what's on the table when ADPs and LLEs meet, not someone else's agenda that the LLE groups are supposed to just respond to or fit in with. And then you move around to analysis. So hearing the voices, we know, is not just enough from LLE groups. The ADPs have to understand the rights that individuals and communities have. And that's where the charter and the guidance and the checklist puts onto the table the rights that people have to the sort of support that they need. And then based on that, the identification is you co-produce an action plan using the checklist and indicators for measuring the progress. And that is the ADPs and the LLEs together developing locally how services need to be better designed, delivered, and monitored. And then the review is the monitoring, is the scrutiny. Have we made progress? Did this work out the way that we intended, or did it not? And what lessons do we have to learn? And how do we learn these lessons? You learn from going back to the communities and the individuals and finding out from them what worked or didn't work, and how do we have to continue to improve things. So it's like a continuous improvement cycle. So that's one example of the way in which the Charter could make a difference if it's actually put into practice along those lines. And then the next slide, if we can move to that, is that the toolkit is very much not a finished sort of product. You know, this is it. We've left a space in the toolkit very deliberately that as people come to use the Charter, we want them to share what experience they've had, what solutions it's found, what progress it's made, where there's been lessons learned, and a need maybe for further guidance or tools or support to put the Charter into practice. So we see very much the toolkit that you'll get, you know, when you go on that link, as being like the spine, you know, the backbone. And then it will grow arms and legs as it begins to walk, as it's used in a whole different range of contexts by people who are involved in advocating on behalf of individuals with being affected by substance use, as well as those who are involved in making decisions about design, delivery, and monitoring of public services. So sort of watch this space, and we put out there a kind of template, a series of questions, making it easy for people to say, this is what we experienced when we used the Charter, and so that we can all learn from one another. And then I think, just to conclude, I think if there's a final one, at the end of the launch on December the 11th in Glasgow, we had a session when we invited up to about 20 people from advocacy, design of services, delivery and monitoring, as well as from ADP and the health, NHS and Grampian, as to how they've already begun to put the Charter into practice, and they shared their experience, including how ADPs and LLEs they think will be able to work better together using the Charter. And so up about 20 of those contributions, you could see a plan coming into focus of the approach to be taken towards using the Charter and specific actions that should be included as part of that plan to implement the Charter. And so when we hold this event early next year, we really want to draw on that contribution that we got to put together a plan for how the Charter can best be used. So we heard, you know, from advocacy, we heard from SDF, from the Scottish Recovery Consortium, from Scottish families affected by alcohol and drugs, by the Argyll and Loch Lomond Advocacy Service, and in the design, delivery and monitoring of services, we heard from statutory providers, voluntary providers, and then scrutiny bodies like Audit Scotland, the Care Inspectorate, HIS, and the Public Services Ombudsman. So a broad range of early commitments to using the Charter, and we look forward, therefore, into the new year to bring that together as part of a plan to put the Charter, make sure it's embedded in all the different forms around the country of advocacy, design, delivery, and monitoring of services. So probably more than enough from me, Austin, and thanks again for the invitation, and I hope that sort of helps give an insight to people who weren't able to come to the launch, just what we did on the day. And I'll pass back to you now.
Thank you, Alan. Yeah, it's good to see it's not just a list of rights, but actually there's been some thinking about how they'll be implemented and what difference they might make, where the touch points might be, and one of those is obviously the living experience work. So our next, talking of which, our next speaker is my colleague Jason Wallace, who's been deeply involved in this and continues to be involved, obviously, in the living experience work. Jason.
Thanks, Austin. Nice to see so many people joining the webinar. Alan, thanks for your presentation. And I just want to acknowledge the rest of the change team. It's been a fantastic process, a lot of hard work over the last 2 years. And I think this is just the beginning of it. There was hard work to get the charter developed and get it launched, but I think this is just the beginning. So in terms of the charter, I'm just going to speak a wee bit about the next stages and what our roles and responsibilities will be. And you've seen for Alan's presentation there that we had identified 7 key rights that are sort of recognised within national and international law, and there's not enough time a day to talk about all of them. But one of the things I would say is one of the first bits of work we need to do, rights holders are aware, they actually understand how the rights might come into play when you're engaging with statutory services or third sector partners or anything like that. I think we've got a lot of work to carry out to make sure people actually know what their rights are and understand their rights. And in terms of the duty bearers, I think for duty bearers who will be staff working in services, delivering services, again, we need to make sure the duty bearers are aware of what the rights are within the charter and how that might apply to their service in particular. And I know through a lot of the work that I've been involved in through managing the Living Experience Engagement Group, that there's a lot of great work at the moment happening, and it probably sits within this charter and some of the key rights. But I think the right I'll kind of speak about the day is the first right that we have in the charter, and that's the right to life. And the reason I'm speaking about that is because that right, the right to life, is protected by Article 2 of the Human Rights Act, and it's already part of law in Scotland. And if we think about stuff through the right to life, then many services will currently be delivering different harm reduction methods, which is aimed at actually preventing people from dying prematurely in terms of drug-related deaths. So they'll be delivering different interventions, naloxone and such. But I think what we need to think about is, in order to make these rights available to everybody and properly embed them in our policy and our service and our practice, there's going to need to be changes. And these changes might be difficult for some individuals or some organisations. But I think what we need to remember is this is an individual's rights. There is people don't get to choose whether somebody has a right upheld or no. If you choose not to uphold somebody's rights, then there's a real big issue there in terms of the individual. But in order to sort of develop, plan, deliver services, I think we need to be straight that people with living and lived experience need to be at the heart of that. They need to be at the heart of the discussions, that decision-making process. Because we see more often than not, there's lots of harm reduction stuff gets delivered across the whole of Scotland. We don't always engage the living experience, the people who are still actively using a substance. We don't always engage them to ask their views or even to ask if that's a service that they would like to see. What happens is we start to deliver these services based on the funding, and then we just hope that we can fit them around the people with living and lived experience later down the line. That needs to change. We need to have living and lived experience at the heart of the discussions before we've even decided to commission services. And that's going to be a key part as a duty bearer for the government, that they start to look at the commissioning process through a human rights lens. And there'll be tough decisions that need to be took by that may mean some services don't continue to be funded or whatever. But if we're serious about this and it's a priority, and some of you that are on the webinar would have been at the launch last week and heard the First Minister talk about how important this is. So if we're serious about it and it's about a priority in making sure people's rights are met, the rights of people who use substances, then we need to be courageous and we need to be willing to make the difficult decisions that might include services not being funded or services delivering it slightly different. I think a key part for you, if you're on this as a duty bearer, is maybe the first step is looking at, do your clients currently understand their rights within the Charter? Do our staff understand their rights? What are we going to do to upskill people and make sure they have the best understanding possible in order to make sure that we deliver services with a human rights approach and we prevent people from dying? We have an atrocious record over the last decade of people dying in Scotland. And this is what drove us in the change team. There was nobody in the change team who was in it because they were trying to get money for their organisations. We were all driven by the same passion. We want to keep people alive. We want to make their lives better. And we want to give people every opportunity there is possible and the best chance not to die early and sort of get to a place where they can live a life that they're comfortable with and it's no longer causing them harm. And within that right to life in the Charter, there's various different parts that we talk about. So near the bottom, we talk about the Orange Book or the Orange Guidelines, which anybody that works in statutory services, prescribing services, will be aware of. This is seen as the sort of prescribing Bible, the Orange Book. But when we actually delve into that, I think what we need to do with the Orange Book is we need to go back to basics with it. Quite a lot of the time we'll hear bits quoted for it in order to help make the argument for people maybe being on a dose of 60 milligrams, millilitres to 120 of methadone. But what we don't hear is the Orange Book's quite clear that prescribing requires, I'll actually tell you what the quote says, the point, sorry. Treatment should always involve a psychosocial component to help support an individual's recovery. So we often hear about, but the Orange Guidelines say this is a therapeutic dose, 60 to 120. We need to go back to basics with it and also apply the other stuff the guidelines say. And the guidelines are quite clear, as I read to you there, about the psychosocial support should always be included. And it goes on further to talk about when you're looking to engage clients with mutual aid, that is almost always influenced by what the professional's attitude is towards mutual aid. So if you don't have a particularly good attitude towards mutual aid, whether it's a 12-step fellowship, smart recovery, whatever it may be, clients will pick up on that. So in the Orange Guidelines, it's quite clear that, and it talks about mutual aid should be supported through active linkage. And what they mean by that is through taking people along to mutual aid groups. Take them along, go to an open meeting, a Narcotics Anonymous, Cocaine Anonymous, Alcoholics Anonymous, whatever it is. Take your client along to an open meeting, go with them, support them. It also makes reference to passive linkage, where it talks about it's not really sufficient just to give people a leaflet or give them a list of times when mutual aid meetings are available, that can be quite difficult for people to walk into, especially if it's their first time ever. So, in terms of duty bearers, what your role is, I suppose, is if you're on this webinar, is to go back and ask the questions within your organisation. What are we doing to meet people's human rights? What are we doing? Are we doing enough? Are we delivering interventions that suit the service and suit the staff? Or are we delivering it because the clients in the community actually identified that was a need and that was something that they needed to support and help them for wherever they were at in their life? Now, I'm under no illusion that this isn't going to be a big job moving ahead, but we've got a charter. Alan demonstrated it quite clearly. The toolkit within the charter is fantastic. At the SDF, we've been using the toolkit, especially the FAIR model, for a number of months now across the 12 engagement groups that we have in Scotland. And we've been using that to interrogate the issues that people raise. And we're getting people into the mindset of when they identify problems within their own treatment or a theme that develops within a particular area, we're getting them into the mindset of identifying them but looking at solutions. And then via the groups, we will take that back to the Alcohol Drug Partnership Management groups, which are made up of various different partners that work ways across all the different health boards in Scotland. And we will take that back and we'll say, here's the issue it's identified, here's a potential solution. And we'll track that through the action tracker that we use with the Alcohol Drug Partnership. So that allows us to go back and review it and say, right, what was identified, what did we put as a solution, and how's that working? It's okay to try stuff and it doesn't work. That's fine. Try something else. So we need to get away from this idea that if we're doing anything new in Scotland, it needs to be a pilot. We don't need to pilot a lot of stuff. Let's just try it. Let's see if it works. If there's elements that work, fine. If there's elements that don't, change them and move away from them. Now, I've got about a minute left, so I'm just going to round this up. You've seen the actual Charter of Rights there, fantastic resource. But myself, Louise, who's part of the change team, Alan, there's a whole big change team there. And I know I can speak on people's behalf. We would be more than happy to reach out and support any organisations that maybe have questions around this or just looking for a wee bit of guidance. Well, how do we put this right in place? How do we make this meet this right? Anything like that. But I hope this is just the beginning and we move forward and we start to view everything through a human rights approach, right for the commissioning process, right to the service development, service delivery, monitoring, evaluation, and the lived and living experience guys need to be at the heart of that. I can't say that strongly enough. If these guys and lasses aren't at the heart of it, we aren't doing it with them, we're doing it to them. And we've done stuff to people for far too long now. So I'll just thank everybody for coming along, listening in, and I look forward to working with many people that are currently on the webinar and a lot of other partners and colleagues across the board. I look forward to working with you to get this stuff rolled out and embedded, and we can all take responsibility to hold government, public service bodies accountable on the behalf of the clients that we work with. Thank you. I'll hand it back to yourself, Austin.
Thank you, Jason. Thanks. Well, you're an inspiration as ever. Not only your enthusiasm, but also you demonstrate that there has been some thinking. So this isn't something that's come down from on high and left for people to interpret. There's some real thinking in there about what this means and what the change it could drive in services and in policy. which leads us to our next speaker, Louise, who, as I said, is the Director of Service Delivery with you, and also was involved in the National Collaborative. Louise.
Thanks, Austin. Thank you, Alan and Jason. It's a pleasure to present alongside you, and it's been a fantastic experience over the past couple of years working with you to develop the charter. And just to kind of echo Jason's sentiments before I start, and on behalf of the change team, myself and Jason, Alan would be more than happy if anyone wants to reach out for any specific queries or anything that we can do to help. Yeah, okay. Thank you. So my name is Louise Stewart. I'm Director of Operations with you in Scotland. I have been a proud member of the change team for the past 2 years, working alongside Jason, Alan and the other members. My role has changed over that time in the organisation that I worked for. I wasn't always Director of Operations. I've held a number of roles. I've worked for this organisation with you for 14 years. I worked in an alcohol service. My first role as a case holder. So I have various roles throughout. So I bring the experience of that and what the charter and working on the charter has allowed me to do over the last year in particular has really informed my leadership style. It's helped me to view our practice and what we are doing as an organisation and trying to support our services across the country to take a human rights approach and view what we are doing through a human rights lens. So we have been delivering services in Scotland for 20 years. We believe that we've worked in a person-centred way using a values-based approach, but the Charter of Rights is it's a further extension of this approach, and what it's going to do, it lets us look and really interrogate that. It'll let us question what we're doing, let us really explore that, try to stand true to our values. However, it will let us continue to embed and improve on that. I think for myself and my own leadership style, I'm aware that as a leader within this field there comes accountability, and on behalf of with you, that that's something that I do embrace. I'm aware that we're in a backdrop of increasing drug and alcohol related deaths in Harlem, so implementing the Charter of Rights is at a crucial time. I know that's been touched on as well, the need for change. Change can be difficult, but it's always going to be worth it. And I'm hoping that through the presentation and what I've got to share, that we're able to see kind of what our approach is and how we can support that. Okay, so today I'll provide some insight from my own perspective around service delivery, what we are doing, and maybe offer some suggestions. I think it's really important that to start this, we look inwards. We get our own house in order, we have a look at what we are doing, and then that's only going to allow us to enhance and strengthen that. We'll look at why the Charter is important, what is our role, what are the challenges, and lastly, what are the solutions. The Charter is important. Scotland continues to have some of the highest harm death statistics in relation to alcohol and drugs in Europe. We've got great services, ideas, policies, yet many people struggle to access the support that they need. The Charter provides a mechanism and framework for our clients to access services, but also to navigate a complicated system. The Charter of Rights sets out roles and responsibilities and duties of services. I know that the system can be really difficult and complicated for us to navigate. So this is going to hopefully help us to do that. And if we find difficulties in navigating services and systems and structures, you can only imagine how that must feel for someone trying to access a service and even knowing what rights are. I know Jason had touched on it as well when we'd done the length and breadth of Scotland, and I don't know that we were surprised when we were starting to talk about rights and human rights that people didn't know or didn't feel that it applied to them. So that was the starting point that when we're starting to think about this. We'd like to thank and hope our services are person-centred, treat people with dignity and respect. But this gives us an opportunity to really interrogate that, if that's true. actually, when you think about the death statistics and the rates of harm, that does tell us that something isn't working and we need to have a different approach. The Charter, when implemented, will start to reduce the stigma and discrimination that our clients face. It will help our clients to challenge decisions and involve them more with their support. I think it comes back to how we actually treat people, how as a society do we treat people, and when we take things from a human rights basis, we look through a human rights lens, it levels the playing field, and it's no longer people then feeling discriminated against because they're using substances. To do that, we need to embrace the role of advocacy, learn from advocacy, and that can also allow us, don't be afraid of that, it can allow us to really enhance and strengthen our service delivery. Okay, so we are the duty bearers. The primary duty bearer is the state, but in the context of substance use, this includes central government, local government, health and social care providers, scrutiny bodies, police, prisons, tribunals, courts and other bodies. From an operational perspective, it's really helpful to understand our role in implementation of the Charter. As a service provider, our role in the Charter is helping our clients raise their rights is crucial. We are the duty bearers, and our role is to help people realise their rights, support people to realise their rights, including those which will be introduced by the Scottish Human Rights Bill. Staff will be workforce will be advocates, implement rights, support service providers to understand how to implement the rights of people affected by substance use, services and organisations to fully implement rights into practice, delivery, policy and procedures. It shifts power and changes culture from the stigma and self-stigma of deserving and undeserving towards one of the rights holders and duty bearers. Services and organisations are there to deliver support, partnership with people, not to people. So what does this look like? We need to support our clients and communities to understand and realise the rights that they have. There's, when we're thinking about this, there's three areas that we need to consider that are crucial. That all brings it back to the client experience, and culture is key. Staff organisational culture, practice and operational, openness, transparency, embrace feedback. For culture, it's important to consider when looking to implement and embed this way of working. Staff and organisations will all have our own way of working, and this is going to enhance that. We need to look introspectively. It starts with us. We need to access training and awareness sessions about the Charter, setting out clear roles and responsibilities. What are we expecting our staff to do? Listen, respond. This is all stuff that we know we're already doing, but it's going to enhance and strengthen. To help shift the culture, talk about the Charter, display posters, leaflets, etc. Use the checklists that are there. Talk about a rights-based approach. How do we know that our clients know about this? So to embed it in practice, ways of working, a few things that we can do to support it, improve, enhance, strengthen, fully embed discussions about the Charter of Rights and to support supervision sessions. How do we include clients? How do we work in partnership? How do we include this in team meetings? Ensuring that we've got client involvement groups that using the voice of the lived and living experiences Jason articulated so well. Reviewing our interventions and how we're delivering them. Are we delivering our interventions in a human rights based approach? Are we using things that are in place already, health and social care standards, for example? Are we placing expectations on people when they're accessing our service? Or are we saying, what can we do for you today? How can we help you today? Without placing an expectation that you must do this or we won't do this. It's shifting that so that it's about the client and their attending and what they're needing and how we're responding to that. Operationally, organisation can also support using values-based recruitment processes, for example, ensuring policies and procedures are human rights-based, that don't contradict or prevent services from implementing these rights, don't take a kind of holistic approach, embracing feedback. I know I've said this, but it's so crucial. Embracing feedback in a culture that's okay. Don't fear it. We should welcome it. We should embrace it. We need to hear feedback we need to hear feedback from our clients, we need to hear feedback from our partners. And it's always good when you hear positive feedback. However, the most important feedback that we can hear is when it's not worked out so well, and what we can do to change that, and using like improvement planning, how we can include clients in that, the role of the care inspector, for example, the benefit of working in services that are registered and regulated along with our staff teams. This is evidence of how we're implementing that. We've developed a new feedback mechanism within the organisation. It's automated, and we're getting really, really high numbers of feedback where we never had that before, and also from people where people have left our services and it's been in an unplanned way, which is crucially important. Okay, so we can all agree on the importance of the Charter of Rights and using a human rights-based approach in our work. It doesn't mean that it comes without its challenges. And what are the challenges? We know that in Scotland, we've got amazing policy frameworks. We've developed so many fantastic documents, and it comes to the implementation. So I think for us, we've been involved in this work and known how much it's needed, that the key thing here is in implementation. Got great ideas, great policies that can lead to confusion for service providers. We've got national policy overseeing our work, national mission, rights, respect, recovery, for example, quality principles, health and social care standards, SSC, and it can be challenging to knit together these requirements and standards, leading to staff being overwhelmed and not sure which thing to focus on. It can be overseeing these standards, requirements and policies require a level of admin support, which is not always available. The standards etc. are not always joined up, which makes understanding and navigating challenging for staff and our clients. However, at least we have the tools to make the services better and more accountable. Another challenge in the sector is around workforce and capacity. Demand for services has increased. Resources have stagnated or decreased. The backdrop, deaths and harms increasing. Staff retention and recruitment is challenging. The service losing experienced staff, struggling to replace them. All of this work needs to be considered when thinking about implementing the Charter in this way of working. However, we must do it anyway. We can't use that as an excuse. We have to keep going ahead with this, and we must embrace it. We can't use an excuse or reason for not implementing the rights into the way that we work. And long-term, embedding this approach and ensuring that people realise their rights will improve outcomes, improve services, which is what we want, increase skills, increase work, short-term but long-term improvements. So just to kind of finish off by saying about the kind of key things we're talking about there: role modelling, partnership working, embrace it, attend network meetings. Partnerships can be difficult, but they're always worth it. Continuous improvement in feedback, especially from when it's unplanned discharges. Use the role of advocacy, embrace that within services, include people at all points, include clients, staff, leadership, wider organisation. Show leadership by talking about the Charter and human rights, challenge ourselves and others when this is not happening. And so to summarise, the Charter is a positive thing. Challenges can be overcome and solutions and support are available. The work will start now. Thank you.
Thanks, Louise. Yeah, well, you're right. When you talk about, you mentioned empowerment and a bit about the balance of power. I mean, that's the crucial thing, isn't it? Because people are denied their rights because they're disempowered. So that whole, this has come up in the questions, that whole human rights approach is an approach rather than a set of outcomes that we're looking for or more paperwork. So yeah, thank you. It's an inspiration. Does everybody want to join me while we take a few questions and have a chat? Hi, Jason. So yeah, we have maybe 6 minutes for questions. There's a few questions come in which Jason has very helpfully answered in the Q&A section at the bottom of your screen. But to summarise those questions, I think one of them is that how compatible is this been thought through? You know, where does this sit with MAT standards? Where does it sit with a national specification and other work that's ongoing in Scotland? How do we ensure that people don't just see this as a kind of another workload issue or another approach, another initiative? Is it anybody want to answer that? Jason, you've had a stab already in the chat.
I think I briefly answered it in chat, but maybe Louise or Alan want to expand that. I was just pointing out that the charter is a legal framework, whereas the match standards doesn't have that same framework. And maybe we should view the match standards as being delivered within the Charter of Rights.
Thanks. Alan, have you got any experience from other films or other contexts where that cultural change is what you're trying to achieve, and how you could go about doing that?
Yeah, but I'll answer that directly, Austin. But can I just say, personally, it was very satisfying to launch the Charter last week, and we had the First Minister and we had the United Nations, and it was a great day. But it's so much more satisfying to hear Jason and Louise talk today, because clearly they've picked up the Charter and they're running with it, and they're translating it into what it means every day in a way that, I, as a lawyer or a professor and all that, is not able to do. So I've been sitting here just feeling that I'm being overtaken now, and this is fantastic. This was always the plan, but to see it and hear it is so satisfying. But to answer your question, I think one of the reasons that I was asked to help sort of kickstart this work was because I had done something similar with this access to justice for the survivors of historic child abuse. And there were a lot of similarities, the power imbalance, the stigma, the self-blame of victims of historic child abuse. And it plays into a lot of early childhood trauma that we know leads to being affected by substance use and addiction later in life. So it was using that experience. And actually, that was one of the keys to getting the support of the First Minister, because he was involved in that work too, and saw the parallels and how it had shifted the power. And I remember it took a similar period of time, about 2 years, but you saw it, just as you've heard from Louise and Jason, in that piece of work with survivors of historic child abuse, you actually saw them stand up, straighten their backs, look at government ministers straight in the eye and say, we have got rights. We don't just pick up the scraps that we're given or told to keep our heads down, and we expect actions. And they got actions, and they worked. So yeah, there is some parallels to this, but the guy from the UN was saying last week, this is the first charter of its kind in the world. And there's a lot of lessons to be learned, but really only if we make it work. And I've got so much confidence now that it will work, listening to Jason and Louise, because they're off, they're running with it. And there's a whole bunch of others in the change team who are the same and beyond the change team. So yeah, we're here to help others. But there you've got a couple of role models right in front of you today.
Thanks, Alan. And I suppose, and this may be our last question, is about measuring the effects of it. Maybe, Louise, you'd like to talk about this. Is there a plan for an evaluation or to measure impact in any way? Or is it a much more subtle cultural change where there'll be the odd phenomenon that occurs because of the rights-based agenda?
Yeah, but of both actually. And just to kind of touch on, I think if we can properly implement this Charter of Rights, it's going to help us implement everything else. So myself, as part of the change team, Biba Brand, who works for the Care Inspectorate, part of the change team, and Jed Brady from Reach Advocacy, part of the change team, have been working really recently actually looking at key performance indicators that are already in existence and trying to use them rather than recreating the wheel. There's so much stuff out there that we can tap into that people might be more familiar with. So it's both the cultural shift, we will see change because of that, and then how to measure using things that are already in existence. So that will definitely be coming in the new year.
Thank you. So unless people have got a final word they need to say, I'll draw this to a close and thank our speakers. Most of all, they've thanked each other, so I'll see some enthusiasm in the room for the progress that's even been made in the last week in terms of presentation. So obviously this is an agenda which will influence all our work in the coming years and ensure people are supported by a range of services that deliver for them. SDF will be keen to promote awareness of the Charter and help ensure policy and practice supports people's human rights. Thanks to all our speakers for their contribution today. Thanks to AJ and Lisa for their support behind the scenes. This webinar has been recorded and will be uploaded to the Scottish Drugs Forum YouTube channel. SDF's next winter webinar will look at innovative work in supporting young people in Scotland. Full details will be available soon. Goodbye and see you soon.